Hello everyone, I'm Leslie Cornwell, Midwifery Business Consultation. The next section I want to talk about in our COVID-19 series is how do you make a quick turnkey birth center? Say there's a bunch of home birth established practices in your community and they're like, we want to serve more women. What are we going to do? What are we going to do? If you have a birth center, a central location, you can serve more women because you have one place. Even if there's two women in labor, you don't have to be in two opposite towns at the same time. You can be in two rooms and you can support each other in a central location. So hybriding that birth center model to maybe have a facility that has privileges for the midwives. Get creative with your team. If there's birth center regulations, see if you can get connected with local health departments, politicians. There's got to be exceptions to the rule for pandemic and crisis situations of making fast turnkey birth centers that don't need inspections and quality and can fit the needs of what's imminently happening. So if you have the advantage you're in a state that doesn't have birth centers, you don't have as many hoops to go through. You might, with the building you're looking at, have zoning concerns, and you'll have to talk to the right people to make sure what you're doing is all okay there. That's why it's nice if you can find a motel, a bed and breakfast, a hotel. It's a short stay. You're not going to have so many issues. It's not a medical procedure that the zoning typically is all right in that situation. So lots and lots to think about. Or even if you're a midwife in the hospital and you're like, okay, I'm not liking the way the hospital is doing this. I've already had frustration. I don't know your backdrop situation with your practice, but if you're contemplating, I want to do these women at home, or my hospital is considering doing home births for our women that are low risk and healthy and putting some bags together, we can help with that. We can help with prepping a quick turnkey home birth practice to fit the needs, especially nurse midwives in the hospital have never done out of hospital birth. So it's a lot of mind shift. It's a lot of feeling comfortable with the resources and being in that woman's home. But it's that balancing act of, okay, if we're going to get everybody sick and we can't take care of them, do we want to do unassisted births? What does that look like? Is that the best option? Sometimes in crisis, we got to talk about all these potential things that could happen. So I want everyone to brainstorm, get creative. There is a challenge out there. There is a need for midwives to fill this drastic need that COVID-19 is out there. The hospitals are going to be flooded with critical care patients, respiratory support patients. Med-surg is going to overflow into the OB wards, and the OB wards are going to contemplate buildings across the street, off-site labor and delivery units to help keep the moms normal and healthy. So help in the cause, help get creative with your community, figure out how you can serve all these women that are looking for out-of-hospital births right now.